So you graduated, you are shifting to the other side of the country. You get a health educator role. Can you tell us more what you did in that role, and then maybe that transition, or maybe that thought process of you thinking about getting your DrPH?
Sure. So when I was working at the clinic, I started off doing tobacco control, tobacco prevention with youth. And because if you think about a school-based health center, so we are a clinic within a high school. And so I would always thought of myself more of as a community health educator because our school is a community. And so what are some ways to keep our community healthy and healthier? And so that was, so my first project was on tobacco. So tobacco prevention, doing groups, doing awareness campaigns. So this is in the early 90s. And then shortly thereafter, I got laid off. And then I came back to do work in teen pregnancy prevention. And so we created a program that was a peer program where youth would bring in a peer and we would talk about, healthy relationships, birth control. Our clinic provided birth control. So one of the unique features of that clinic was a very comprehensive clinic with medical, mental health, or now called behavioral health, and in health education. It's just very comprehensive. And so I did that program for several years. And then we had another different program that had to do with nutrition. So that was for a few more years. And then we went back to family planning and kind of another comprehensive teen pregnancy prevention initiative that was actually from the state, and did that for quite a while until, funding ended. And then we had another kind of like another shift. And that's when the youth advisory board was developed through this other small grant that we received. And this is a huge initiative from the Kellogg Foundation and the State Association for California, where they were one of the recipients of this grant. And so we also were the recipients of the grant from the California Association. And so that was a role for me then, was to teach about minor consent, the law, and develop a youth advisory board, and really to promote school-based health centers. And that was for 5 years. So I just want to also clarify too, that at this time, I was working part-time. So having 3 kids, I was very lucky that I was able to work 20 hours a week, especially when my son was born, my second child. It was just very difficult to really put in those 40-hour per week. It's very challenging, and also challenging being that we didn't have family around. So I was really, very lucky, very fortunate that I was able to do that. And so because that's important when going to grad school. So it was when I was, so that must have been that was in 2011 that I decided that I got into the DrPH program. But prior to that, I really was, again, trying to find a school that was the right fit for me and for my family. And it was the same kind of situation. So UC Berkeley, again, only wanting people that would be available in, that a 9 to 5 kind of situation that is like, I just cannot do this. I'm working and all that. And I remember going to one of those American Public Health Association meetings. This is why going to conferences are important. And and this is when I was an MPH student. And I remember going to all the different tables, looking at all the different programs that they had there. And one of them that made an impression on me, but, it's just put it in the back of my mind kind of thing, was a program at Loma Linda University. They had an online program, even back then, or some type of computer program. It was just something very different from all the other schools. And it was something that I was just like, oh, that's pretty interesting. And I remember saying to the person, you should do this for the doctoral program. And at the time, they only had the MPH program. And so that was something that I kind of like put away, that, okay, I'm gonna have to put that idea away. I can't find the right program for me. So many years later, we had an intern at our clinic, and she was going to Loma Linda. And then she was showing me how they were doing it online. And she was an MPH student, but she told me that I think they have like a doctoral program. I don't remember. She said, I think, or you should look into it or something like that. And that is how I found out that they indeed had a doctoral online program in health education, health promotion and health education. And so then I applied. Had an interview, and the rest is history. I got in, and I started the program in 2011. And again, just being very fortunate to have a very incredible clinic coordinator, different one from the previous one, Michael. He just totally was able to, we were able to work it out. And I'm just so grateful for that opportunity. Yeah.
Well, shout out to Loma Linda. I think that's a good little promo for them, and I think
It is.
right. I think it also just speaks to the power of connecting with organizations at conferences, because as you said, like you had that interaction. You said, "Hey, you should really think about this for your doctoral program." Maybe that was the thing that got them going, and they started building that out, and then even learning how you learned about it is like not directly looking into the program, but just having someone around you that was in the MPH program and kind of spoke to it. That is truly awesome, and I'm glad that you were able to find a program that would be able to cater to the needs. And I think that's something that's very important, especially for many people in public health. Is like, how do you, I don't want to say balance, but how do you like navigate the school work life type of skills and things that you all have to do?
It's so true. And especially when you become when you're a parent, and or if you're taking care of your parents, and there's so many factors, and it's really nice to be able to, and now there's so many online programs, which is great. I mean, and they're all accredited programs. I made sure that Loma Linda was accredited. That was very important to me. Accredited through the Council of Public Health Education. So I'm really wanting to make sure that the programs that I participated in as a student, that they were going to be, that I was going to be able to get a job, and because my program was accredited. And so that was very important to me, for sure.